Hello students, now we'll talk about a very important topic, research limitations and delimitations. Okay, so let's start first with the limitations. So what is limitations? Limitations are the influence that the researcher cannot control. Okay, these are the shortcomings, conditions or influences that cannot be controlled by the researcher and place restriction on the methods and conclusion of the research. Any limitation that might influence the result should be mentioned. That is very, very important. So limitations, in a simple term, you can say these are the weaknesses of your research. And why there are weaknesses? Because you always have to set certain boundaries while conducting your research. Like for example, if I say I will collect the data by having a self-report measurement, I'll ask question to the people with a self-administered questionnaire. No, there is a one shortcoming in this. Whenever people answer by their own, they may give a socially acceptable answer. Like if I ask people about their professionalism, they may rate themselves very high. So this become a limitations for the research, because eventually it will affect the generalizability of the findings. So whenever you conduct a research, you will always have a limitation. There is no research without limitations. The most important thing in limitations are that you have to mention that limitation, so the readers can understand what are the identified weaknesses in that particular research. So while evaluating the results and conclusion, drawing a conclusion from your research, they can understand what are the weaknesses were there in your research. Okay, and limitations usually we mention in the end of the research, like once you conducted the research, and after conducting the research, then in the last chapter you are mentioning, you are writing about the limitations. Because while conducting the research, either it's about while framing the operational definitions, or by deciding the sampling technique, by deciding the methods for data collections, tools and technique, even applying a specific statistical test also can lead to certain limitations. Okay, so limitations are all about that. Now let's see limitations with one research example here. Like this is a title, socio-cultural discourse of children engaged in child labor in India, a macro-ethnographic research. This is a research and this is published in a PubMed. You can just see the link and you can just read the complete limitation for that. So this study was conducted where ethnographic qualitative approach were used, and they wanted to study the socio-cultural discourses of children engaged in child labor. So what are the limitations? Two limitations I have mentioned here. The one, a macro-ethnographic approach was used with a study focusing on broadly defined culture. As a result, it is possible that smaller unit of culture were not thoroughly or finely studied. So here they are talking about two things. Number one, they mentioned about what exactly is the weakness, hai na? Okay, they are talking about what is the limitation. Okay, and what happens with that weakness. What is the weakness in this? The weakness is they only studied a broadly defined culture. And what happens? What is the outcome of that? What happens with this? We could not study the smaller unit of culture. Okay, were not thoroughly or finely studied. Now, outcome, then what is solution? What researcher has done to control that? Okay, however, participants' observation were used, which is more thoroughly and illuminating. So here every limitation should have at least these 3 points. Number one, what is a weakness? Because of that, what exactly happened? Okay, you did something, what you've done, what is a limitation, and because of that limitation, what happened to that research and that inquiry, and how researcher justify that. Okay, so in this, as you can see, what that they only studied a broadly defined culture, and because of they studied broadly defined culture, they fail to study the finely defined culture. There are possibilities. And what researcher did to control that? Even though they have used participant observations, it is one of the best technique where you become a participant of that culture and then you observe the things. So there are more chances that you can observe each and everything. Okay, so this is how we write the limitation. Let's see the second one. Because of the study has a small number of participants, so this is what they did. This is the limit. This is what they put limit. And what is the outcome? The generalizability of the finding may be compromised. So that is the outcome. And what the researchers, what remedy they did may be compromised despite the fact that the data saturation principle was strictly followed. Now this is what researcher did to overcome with that. So I have seen in a thesis or in a papers, people write about only the weakness. They only will say the study is having a small sample size and for that there is a limited generalizability. You have to mention these three things whenever you describe the limitations. What you did as a researcher, what was the outcome of that, in what manner that lead to a weakness, and how you suggest or justify that weakness. Okay, so there are some of the articles, if you look at here, these articles you can just see in a PubMed and study the more limitations. Similar topic is a delimitations. Okay, people often confuse between delimitations and the limitations. Okay, so let's first understand what is delimitations and then we'll compare what is limitation and delimitation and what is the difference. Delimitations are the set boundaries of the research work, okay, or dissertation. So it's a set boundaries, it is desired, it is deliberate, it's a deliberate boundaries, okay, that you put in your research. Because why? Because so delimitation are the researcher control, because you put it direct. Like for example, I will collect the data only from 200 subjects. That is my boundary. I will only take the data from people who speak in English, maybe my delimitations. I will only collect the data by using observation method, delimitations. I will only apply so and so specific test to analyze my data, delimitations. Okay, delimitations are set so that study goal do not become impossible, large to complete. So the ultimate purpose, the main purpose of putting delimitations are to make your research more feasible. Okay, it make your research more feasible, or practically it make it possible. Like for example, if you want to conduct a research among nursing students, somewhere you have to delimit how many samples are required. Somewhere you have to delimit what would be the method of data collection. Somewhere you have to delimit your geographical area. Otherwise, you cannot study each and everything in that. Okay, so it's set boundaries. If you see the example here of delimitation, include like objectives, research question, variables, theoretical objectives that have adapted, and the population chosen for the targets of the study. So all these are putting the delimitations. If I just take one by one research questions in a research, like for example, in my one of my example, I will only study the factors affecting professionalism as described by the subjects. That's it. So that is research question. Variables, I'll include that, like for example, I'll measure someone's blood pressure by using sphygmomanometer, mercury meter. Okay, variables. Theoretical objectives or population, sometimes we put the delimitation for the populations. Like I'll only take the population residing in so and so area and so village. I will only take that specific geographical territory. So all these are the delimitation or boundary that we put. Again, let me remind you why we put all delimitations, because we wanted to complete the research in time. We want to make it feasible and practically possible for one to do that. Or we have many constraints, like for example, resources are limited. Okay, so by stating the delimitations, researcher clearly inform readers why they choose this course of study. So limitations were something that were out of control of the researcher, whereas the delimitations is a deliberate effort by the researcher in terms of putting the boundaries of the research. The purpose of delimitation only to set boundaries to make your research more feasible. But remember one thing, whenever you put delimitations, the delimitations can lead to limitations. Let me give an example. If suppose you delimit your research by saying that I will collect data only from the private nursing colleges available located in my 100-kilometer territory. So this is your boundary. But when you put this boundary, it will create one weakness. It may lead to one weakness. What is that? As you are collecting data from a specific population in a defined geographical area, it may compromise your generalizability. It may affect the study implications of the results. So that become a limitations. So delimitation somewhere lead to the limitations. So that's the one difference. Second is delimitations is deliberate. Limitations are out of control. It may not be in your conscious control. Delimitations we put in a beginning of your research. Okay, while planning your research, you put the boundaries. There you decide what can be done and what cannot be done. Whereas limitations you evaluate at the end of your project. Once your project is done, then you evaluate that. Okay, if you look at the example here, the same research example, a randomized control trial to determine the effect of nurse-led brief psychosocial intervention on body image distress and the treatment compliance among patients undergoing treatment of cancer. So what delimitations are there? Two I have taken. There could be many delimitations. A post-test at 20th day of intervention. That is a one boundary. हमने क्या बोला कि हम जो intervention का effect है, that we are going to assess on 20th day of the intervention. Now someone can put a question on the why not on 15th day, why not on 30th day? Researcher consider its practicality. He also have seen the literature, and on the basis of that he might have reached at this particular decision that 20 days are sufficient for someone to see the effect of psychosocial intervention. Okay, but whether this intervention would be effective after 30 days or after 2 months or 3 months, we cannot answer that. That is a limitations. Okay, because you put it only on 20 days, or sometimes you say I will observe the outcome only once or twice. So that automatically delimitations become a limitations. Now sample size based on the power analysis. How many samples we are going to take for that research, we will decide by doing the power analysis. Now that is another delimitation. I will not take 30, I will not take 5,000, I will not take 1,000. I will take whatever is I get from the statistical calculation of power analysis. Okay. Apart from that, there could be other delimitations, like you can just define how you are going to measure the body image. You can say it's a one-time self-report measure of body image, or how you are going to define your psychosocial intervention. You can again delimit that each intervention may be for 20 minutes a day or in a group of 10 people. So all these are the delimitations. Indirectly, what I'm trying to tell you is your operational definitions are also a kind of delimitations. So whenever you look at an article or a thesis, you just see both the things. You see what declared delimitations in the delimitations section, or you also have to check the operational definition, because that also will tell you. Now once you see the delimitations, it will trigger the researcher or reader to see what are the limitations might have caused due to these delimitations. Okay, so that you can see at the end of your chapter. Next important topic, that is operational definition. So there is a considerable confusion about operational definitions. Whenever I look at the thesis or something, okay, I have seen that many people state the operational definition in a wrong manner. So let's understand what is operational definition and how we can state the definition in a correct way. An operational definition is how researcher decides to measure the variable of the study. It is a method that researcher decide or adapted to measure the study outcome variable. Let's say I just want to study, in this example, I just want to study body image distress. How I'm going to do that? That is operational definition. If I say I'll measure by using self-reported tool or scale score, that's it. So that become my operational definition. How we are going to measure? Okay, it is specific way in which a variable is measured. What variable? Usually the dependent variable, the outcome variable. Even the operational definition, we define all the terms that mentioned in the statement actually. Okay, so there are usually hundred of ways to measure the dependent variable. What measures you adopted? Let's say I would just want to measure the professionalism. There are various ways, like observation. I can make an observation. I can go to the various institution. I can see how the nurse educators are working. I can observe their professional etiquettes and behavior. Or sometime self-report, where what I do, I ask certain question to them, or sometime maybe I ask the peer review. So there are three, or there could be many ways. So which method I will adapt, or I have adapted to assess the professionalism? That is the operational definition. Okay. Now, what is the importance of operational definition? It is critical to operationally define a variable in order to lend the credibility of the methods and to ensure the reproducibility of the results. I'll just focus on that. Okay, one is credibility, how people should trust in the methods which you adapted to measure your variables. If you make it operationally clear, concise, then it will be more valid. Okay. Secondly, how will you reproduce the similar results? Operational definition can help you. Like for example, I just want to assess the knowledge. Okay. And how to assess? What methods I can take? I just take a self-reported questionnaire or self-administered questionnaire. There are 20 questions which I'll ask to the subject. Now, this is my operational definition of assessing the knowledge, ki what score they obtained out of 20. Suppose each question carry 1 mark and somebody answered 15 question correctly, so person will get a 15 marks. So that is a score obtained by a person on a scale. How can I make it reproducible? If I want to assess the same knowledge of the person or any person, I can administer the same tool, same 20 marks item questionnaire and produce the similar reproducible results. So if you don't do that, if you don't define your variable operationally, if you don't define, you say knowledge is, we'll assess by conducting a test, that your only written test. What test? It's a verbal test, a written test, or it is a viva, or what kind of, how many questions? So then you will not able to produce the reproducible result. That is why it is very, very important to define each variable operationally. The operational definition also help to control the variable by making a measurement constant, you know. So it also help to control the variable. Like for example, if suppose I just want to see the blood pressure of somebody, and operationally I have decided that what is the operational definition of blood pressure? It is a measurement score on, let's say, BP apparatus. Okay, in supine position at 10 a.m. in the morning. Okay, in their home. That is operationally I have defined that what is a blood pressure measurement. It is a measurement of blood pressure with the help of BP apparatus, where the patient will be in a supine position and the blood pressure will be measured at around 10 a.m. in a morning in the patient home itself. That is my operational definition of measuring. So if suppose I have to record it again, let's say I have given some intervention for 5 days or 10 days and I just want to see the effect of that. Now second time I'm not using this blood pressure, or I suppose I'm using the same blood monitor but not a supine position. So second time I went and just checked the blood pressure when patient was in a sitting, okay, or he was not at home. He was sitting in a community area, community center, and where I find the patient and I observed it, or not even at 10 a.m. So that can produce a variation. So initially, suppose person had a BP, systolic BP is 130, and after 5 days, the person is having a blood pressure of 140. So this variation may be attributed because of your intervention, or maybe because of variation in your operationalization, variation in the measurements. First time in a first occasion you have measured in supine position, second time in a sitting position, that also can create. So if you want to control all these extraneous variables, you have to make it operationally clear. Operational definition describe the variables researcher will use as indicators and the processor used to observe or measure them. Okay. Now, it is also help to describe the variable in an understandable language. Like as I said, what is knowledge? Knowledge is nothing. It is a score obtained by the students on a 20-point questionnaire where 20 item series, where each item or correct response is awarded with a 1 mark and wrong answer awarded with a 0 marks. So the marks or the score what you obtained will determine your knowledge or will represent your knowledge. So this is how you describe. Like in this particular example, I have to operationally define what is this nurse-led psychosocial intervention. If I am saying a brief, what brief, how brief it is. So I can define it by, okay, nurse, it is an intervention which has a component related to the psychological health that may include like 1, 2, 3 technique or whatever you are doing. It will be administered for a brief time interval, that is 5 to 10 minutes in the outpatient department of the hospital where patient is visited. Okay, and these interventions will be given in a series where each session may last for so and so duration, and these many people can attend at a time, will be delivered directly by the researcher or by the nurse only. So this is how you can make operationally define of your variables. Okay, so that's a very, very important point. Now every study need an operational definition because we can't measure anything without it, no matter how good conceptual definition might be. Now simply if I talk about a conceptual definition, what is a conceptual definition? Let's say example, knowledge. Wonderful definition, conceptual definition of knowledge is awareness. Awareness of something. So if I want to assess the knowledge of 50 nursing students without having an operational definition, I have to check their awareness. How I am going to do that? What methods? Whether it's observation or is a self-report or how many items. And that is why you see whenever examiners are coming to conduct a practical viva and all, if the examiner don't define it operationally, you will find this some of the examiner will take a longer time for the few students. Usually, in the beginning of that viva, they'll ask many questions to, the student, those who are coming first. And they'll ask only 1 or 2 questions to the students coming in the last. Because they have not defined their measurement operationally. But you might have seen that some of the examiners, what they do, they ask fixed number of questions in a same manner to every student. They might have decided, I'll ask 5 questions to each student. These 5 questions I'll ask from these many systems. Okay, I will not repeat these questions. So like that they can operationally define it. Okay, so conceptual definition is another thing that will help you to understand overall conceptualizing the operation, even conceptualization of your variable. But end of the day, it is about the measurement, how you are going to measure it. Like for example, if I say emotional response, okay, I just want to measure the emotional response. How we are going to measure emotional response? I'll say like, I'll measure the anxiety. So anxiety has a wonderful definition, but how? I'll measure with a self-administered questionnaire or scale, where the 20 question I will ask. Someone operational defined, no, I will not measure self-administered. What I'll do? I will ask, I'll observe. I'll observe palpitation, I'll observe palm heart sweating, I'll observe their perspiration, I'll observe their pupil conditions, all that. Okay. Now let's take this example. And in this particular example, randomized control trial to determine the effect of nurse-led brief psychosocial intervention on body image distress. Same example I have taken. Let's see how operationally we have defined it. In this is a body image distress. So what is that? It refers to the body image distress that is characterized by dissatisfaction with their physical appearance as measured by body image distress scale, as measured by score obtained by the participants on a particular scale. So for me, that become a measurement of body image distress. If you look at the treatment compliance here, it refers to the degree to which the patient conform to a medical advice about the ongoing treatment of cancer that may include the physician suggested lifestyle and dietary modification, keeping appointments for the follow-up, and taking treatment as measured by treatment compliance assessment scale. So clearly what researcher is defining here, they are saying what is non-compliance. Pehli baat, if you are not adapting what physician has suggested you, maybe in terms of your lifestyle or dietary modification, keeping the appointments as advised for follow-up, taking treatment or medicine as advised. And how I measure that? By adapting as treatment compliance assessment scale. So whenever you define something operationally, just simply talk about how you are going to measure it. What is your measurement tool? Okay. In the same way, like if you can define here nurse-led belief psychosocial intervention, yes, you can define. Let's see, I'll define it. Nurse-led means it is nurse administered. Okay. Multiple sessions, or I can say offline, okay, duration 10 to 15 minutes, group, just 2 to 4 patients, location OPD, and then I can just talk about the components also. Components maybe they work on a body distress, maybe they will have some motivational kind of things, whatever they are doing, okay. So I can just write what would be the part of that intervention. So it is clear now, brief psychosocial intervention, it is something that is prepared or administered by nurse for a duration of 10 to 15 minutes with a group of 2 to 4 patients in the OPD, and how you can define in different ways that, like maybe on every day or alternate day or whatever, okay. So when someone reads your operational definition, they should have a common understanding that what exactly you are going to do with that. So that is all about the operational definitions. So you can just refer some of the articles, like as I can see here, I have given a link here. You can see the articles, and there we can see you can see all the limitations, delimitations and operational definitions. Thank you so much.